Nurse, what made you most uncomfortable when a patient took off their clothes? 1. As a nurse, we see naked bodies all the time. You've seen one, you've seen them all, so we like to say. However, there was one time, in particular, I was disturbed at what I saw. In the emergency room, people from all walks of life, from all different backgrounds come in to be seen. One day, a woman, who happened to be homeless, came in to be seen for a wound that would not heal. This woman seemed to take care of herself as best she could. You wouldn't have thought she was homeless at first glance. I said, "Okay, let's take a look." So she casually starts taking off her blouse. I asked her if she wanted me to leave the room. She said, "No, that's okay." Even though she asked me to stay, she seemed a little shy, and hung her head down in shame. I turned my back to give her some privacy. As usual, hospital staff try to make a person feel more comfortable by providing them with some kind of dignity, and maybe even throwing a corny joke in there. When she said she was ready, I turned around and asked her where the wound was. Exactly. She pulled down her gown, and her whole breast and half of her chest was eaten away from cancer. It smelled like death and looked even worse. I didn't expect the wound to look like this. We as hospital staff always have to keep a poker face, so that we don't make the patient feel bad. She then apologized about the smell and said to me, "I try to keep up with the smell as best I can, but it still stinks." I then reassured her as best I could. She told me she didn't know what it was and why it had spread the way it did. She said she wanted to get to the doctor sooner, but she didn't have health care insurance and didn't want to rack up any bills. My heart sank to my stomach. I told the doctor right away to please come in the room. I felt so bad knowing what it was right away, and now, as if she wasn't down on her luck already, we had to tell her what it was. That was sad. I felt so bad for her, too. Many years ago, in England, I had a girlfriend who was training as a nurse. She was full of stories of objects and vegetables she'd seen people injure themselves sexually with, but one story reduced me to uncomfortable laughter. A man arrived in the emergency department one day and opened his raincoat. He was naked underneath. A milk bottle was attached to his gorged member and he couldn't remove it. The medical staff eventually had to break it, and yes, I can hear your sharp intake of breath as you imagine that moment. But how had the bottle got there? The man had the gall to explain that he had placed several empty milk bottles beside his shower cabin so as not to forget to put them out for the milkman afterwards. While taking a shower, he had slipped and fallen out of the cabin in such a way as to jam, accidentally, his penis in the bottle. His erection had occurred as a reflex. Yeah, sure. 3. As a nurse, the most uncomfortable situation arises when a patient unexpectedly disrobes, compromising their privacy and boundaries. It's vital to maintain professionalism, respect, and ensure the patient's dignity while addressing their immediate needs or concerns within the scope of medical care. 4. During my pediatric rotation in nursing school, we had a 2 or 3-year-old little girl admitted to my floor. She was assigned to me. She had been removed from her home, was in DHS custody. She had been given a little gown that didn't fit, it hung loose. As I approached her, I saw that she had no panties. She was already frightened, confused, traumatized. Was having her dignity taken as well? Oh, no, no way. I told her we had diapers, no pull-ups back then, she could use as panties, but she didn't want them. I called every floor central supply to try find some item to cover her bottom. Nobody had a single thing. Nobody could take a break right then to run to the store. The social worker said she would bring the girl